Today we're going to talk about the pathophysiology of cancer, how this disease actually begins, develops, and spreads. This is where we move past just naming cancer as a condition and really get into the process of how it happens. Cancer begins when a cell undergoes a mutation in its DNA. Sometimes those mutations are inherited, and sometimes they're acquired during life. But either way, they cause the cell to stop behaving the way it should. That one altered cell can clone itself and start to grow out of control, ignoring all the usual stop signals from the body. Under normal circumstances, our cells have safety checks in place. If something goes wrong, DNA repair mechanisms or programmed cell death, apoptosis, will usually take care of it. But when a mutated cell slips past those safeguards, it can invade tissue and eventually gain access to the lymphatic or blood system. That's how cancer spreads throughout the body, and that spread is what we call metastasis. Now, not all tumors are the same. Benign tumors are made of well-differentiated cells, which means they still resemble the tissue they came from. They grow slowly, tend to stay in one place, and while they can cause problems if they press on vital organs, they don't spread to other parts of the body. Malignant tumors are another story. These cells are poorly differentiated, often growing quickly, invading surrounding structures, and causing widespread damage. They don't respect boundaries. They can lead to weight loss, anemia, and systemic illness, and if their growth isn't controlled, they will eventually cause death. The actual development of cancer, what we call carcinogenesis, happens in 3 stages: initiation, promotion, and progression. Initiation is when a carcinogen, maybe a chemical, radiation, or a virus, causes that initial DNA mutation. Sometimes the body repairs it, sometimes the cell dies, but occasionally the mutation sticks. Then comes promotion, where repeated exposure to certain agents, things like hormones or tobacco smoke, causes the abnormal cells to multiply. The interesting thing is that promotion can be reversible if the trigger is removed. Finally, we get to progression. This is where the cells become more malignant, they invade tissues, stimulate the growth of new blood vessels, that's angiogenesis, and they spread to distant sites. At the molecular level, this process involves oncogenes, which are like on switches for cell growth. When they get stuck in the on position, cells just keep proliferating. Tumor suppressor genes, which normally act as the brakes, may be damaged or turned off. Together, those changes set the stage for uncontrolled growth. Now, it's important to understand that not every rapid cell growth is cancer. Our bodies naturally go through changes like hypertrophy, hyperplasia, and dysplasia. But neoplasia is different. Neoplasia is uncontrolled growth that doesn't follow any normal physiologic demand, and that's what defines malignancy. The causes of cancer are complex, and usually more than one factor is involved. Viruses and bacteria can play a role. HPV, hepatitis B, and Epstein-Barr virus are classic examples, and Helicobacter pylori is linked to stomach cancer. Physical agents are another contributor. Things like too much sunlight, chronic irritation, radiation, or asbestos exposure. Then we have chemical agents, and tobacco tops the list. Tobacco use alone is responsible for about 30% of all cancer deaths. It's not just smoking. Secondhand smoke, e-cigarettes, smokeless tobacco, and workplace exposures to things like pesticides, benzene, or formaldehyde all add to the risk. Genetic and familial factors are also important. Some families carry inherited syndromes like BRCA mutations, Fraumeni, or Lynch syndrome, which predispose them to certain cancers. Beyond genetics, lifestyle choices make a big impact. Obesity, alcohol use, poor diet, and physical inactivity together account for about 16% of cancers. A diet high in red and processed meats, lots of fats, or heavy drinking all increase risk. Hormonal factors play a role too. Estrogen, progesterone, and testosterone can influence tumor growth. Reproductive history matters as well. Early onset of menstruation, late menopause, or never having children increases the risk of breast and endometrial cancers. One of the most fascinating aspects of cancer biology is the role of the immune system. Believe it or not, our bodies develop abnormal cells all the time, but our immune system usually detects and destroys them. This process is called immune surveillance. Specialized T cells and B cells recognize abnormal antigens on cancer cells and mount an attack. The problem is, cancer cells have ways to outsmart the system. They can change their surface proteins so they're harder to recognize, block immune cell binding, or even release signals that turn off immune responses. Some tumors produce molecules like PD-L1 that bind to receptors on T cells and shut them down. That's actually the science behind a newer class of treatments called immune checkpoint inhibitors. When the immune system misses or is suppressed, cancer gets the opportunity to grow unchecked. This is why people who are immunocompromised, transplant recipients, people living with AIDS, or those treated for previous cancers have a higher risk of developing new cancers. And here's why all of this matters for nursing practice. Understanding the pathophysiology isn't just about passing a test. It helps us connect the science to patient care. It shapes how we teach patients about prevention, how we assess family history, how we recognize risks, and how we support new therapies like immunotherapy. At the end of the day, our job as nurses is not only to treat the disease, but also to help patients understand it, manage it, and in some cases, prevent it altogether.